terms of also what type of care that they may need and follow-up. Okay? Because we're going to see a lot of terms, so this will sort of put context into that. So the three conditions that we're going to talk about today are hepatitis C, diabetes, and congestive heart failure. Okay? And then in the future, if there are any other conditions that you see on a frequent basis, if you can touch base with me or Leslie regarding any of those conditions, then and we can always work on additional presentations, for like HIV or cancer or other things. So before we talk about hepatitis C, let's just talk about the liver, okay? So the liver is one of the most important organs in the body, and it does many, many different things. So this is a chart picture that I sort of created telling you what are the different things that the liver does. So the first thing is that the liver removes potentially toxic byproducts from certain medications, so it's sort of like a filter. Also, it stores certain vitamins in your body, so it's sort of like an attic. So that way, if you miss meals for a few days, the liver stores certain vitamins, so that way your body doesn't deplete, acutely. It breaks down and metabolizes nutrients from food to produce energy, so that it aids in digestion. It also is an organ that makes things as well. So it makes proteins that the body needs. Okay. It also makes chemicals that help your body digest food. It also makes sort of these compounds that help you make blood clots. And it also helps your body by fighting infections by filtering blood that leaves the colon, the intestine areas before it hits the heart. It goes through the liver to help filter out any bacteria that may have snuck in, through the blood that way. Oops. Next slide. So cirrhosis is a term that I'm sure that you guys have heard about, but cirrhosis is scarring and dysfunction of the liver. So on the left-hand side is a picture of the liver, and I'm not sure if you can see it clearly, but the liver is normally this really beautiful ruby red organ with a very smooth, silky surface. If you ever go to like the meat market and you happen to pass by the chicken livers, okay, it's very smooth. Cirrhosis is when there's scarring in the liver and you see these little nodules, okay? So that's liver cirrhosis. And so cirrhosis, it's not only a structural abnormality of the liver, it's also functional as well. Because the liver doesn't look right and it's not acting right as well. So the three main causes of cirrhosis in the United States, number one, by and far, is alcohol use. Okay? Number two is chronic viral hepatitis, hepatitis C. And number three is something called fatty liver, which is caused by obesity and diabetes. Okay? So basically, I'm just going to review briefly what these three things are, but we're going to spend most of our time talking about viral hepatitis. So alcohol. So your body and the liver has an amazing ability to heal itself. So you go out for a night, you have a shot of whiskey, a shot of vodka, and your liver gets a little bit inflamed, right? But then it bounces back and it can heal. Okay? You can do that so many times, but once you begin drinking a lot every single day, the inflammation sort of stays, and the liver sort of uses all of its capacity to heal itself, for the first few weeks, first few months, but then after a while it gives up. And then once your liver starts losing the capacity to heal itself, that's when the scarring begins. Okay, so that's how you get cirrhosis with alcohol. Chronic viral hepatitis, hepatitis C. And these are actually microscopic pictures of what the hepatitis C virus looks like. So they look like little Christmas ornaments. Yes?
I have a question. So if somebody drinks alcohol every day and they stop, is there like a way to reverse the scarring, or can it heal itself?
So there is some capacity after they stop drinking for the liver to heal itself. But scarring, as you know, if you have a scar on your skin, it's not going to go away, right? No matter what you do to it. So same thing with the liver as well. That scarring is there, but the cells that are alive and are normal, they can sort of grow a little bit around that scarring to heal. Okay? But you can never really regain full function of the liver once you develop that scarring. The scarring is more of a latent stage. Okay? So basically, viral hepatitis, these are what the little virus particles look like They look like little Christmas ornaments, and basically these little knobs that stick out sort of attach specifically to the cells in the liver. And so that way these viruses zoom in on the liver to infect it. Okay. And then once they attach to the liver, that's when they do their damage. Okay, we'll talk more about that in the next slide. Fatty liver, so basically fat is normally not a part of the liver, but basically sometimes for some people, when you're overweight or when you have diabetes or other like metabolic diseases, fat gets deposited in the liver and normally it shouldn't be there. So that fat that normally shouldn't be there can cause inflammation and irritation in the liver, and then over time that can cause scarring as well. So basically fatty liver is like, like you've heard about that fancy French food, the foie gras, which is just basically you feed a goose so much food that it gets a fatty liver. But that's what foie gras is, that delicacy, but in people that's bad because that causes cirrhosis. So sources of hepatitis C infection, we talked about the 3 most common causes. And then in hepatitis C, number 2 from the last slide, 60% of people who get hepatitis C are from intravenous drug use. Okay? And then 15% of people who get hepatitis C is from sexual transmission. And sexual transmission, people say blood needs to be involved somehow. So even though there's a theoretical risk of getting hepatitis C through vaginal sex, that's more of a theoretical risk, and the risk of that is just exquisitely small. But most of it is through sexual transmission, where a little bit of blood passes through the skin membranes and things like that. So, for example, sex where it's a little bit more traumatic, like anal-receptive sex, for example. Sex when there's blood in the vagina, or other forms of sexual practices where blood and body fluids sort of transmit. Okay, transfusions, and luckily in the last 20 years, this is now a really small risk, just because screening is so good now for blood transfusions against hepatitis C. Okay, you can get hepatitis C through hemodialysis, healthcare workers, perinatal. Like there was a dentist I think a few years ago who had hepatitis C, and he didn't use his gloves correctly, so he got these little micro tears, and as he was doing surgery in people's mouths, he was transmitting hepatitis C to them. Okay.
Wow.
But many of our clients fall in this range. Okay, so what happens when you get hepatitis C and you get cirrhosis? Okay, so hepatitis C, many people have hepatitis C and they're just carriers, meaning they have the infection in their liver and it doesn't cause any damage, and it can live inside your liver for 20, 30 years without causing any complications, okay? And a small subset of people with hepatitis C. So when you get exposed to hepatitis C, actually 20% of people who get exposed to hepatitis C, they clear the virus, okay? Which means they get exposed to hepatitis C, and then, hey, 6 months later, the body does something and you're cured of hepatitis C. That's 20% of people. 80% of people who get exposed to hepatitis C winds up going to their liver and winds up staying there, okay? That's what we call a chronic hepatitis C carrier. And in these patients, the vast majority of folks, they have hepatitis C in their bodies, they remain infectious if they were to transmit blood from somewhere else, but it doesn't cause any problems because the hepatitis C just hangs out in the liver and it doesn't really cause any problems. But in some people, 20% over 20 years, the hepatitis C that just hangs out in your liver causes cirrhosis. So you can see hepatitis C is not necessarily an emergency if you get an infection, but you get these problems over the long term in some people, okay? And certain things that you do would increase your chances of hepatitis C that you have inside of you causing cirrhosis. So if you drink and you have hepatitis C, that makes it worse. If you have HIV and you have hepatitis C, that makes the hepatitis C worse, okay? So basically, once you get the cirrhosis, the scarring, the liver doesn't work well anymore. So you can see a lot of different things that can result from that, okay? So the first thing is, on the upper left-hand side, you see that guy's eye, you see how yellow it is? That's called jaundice. So people with liver disease where you have cirrhosis, the liver isn't able to excrete out some of those poisons that we talked about, okay? So when it doesn't excrete out some of those poisons sort of remain in your body. One of them is called bilirubin, and it stays in your skin and your eyes, and that's why people with really, really bad end-stage cirrhosis, they have like a very yellow complexion. Okay. This picture up here, it's of someone's esophagus, which is the tube that connects the mouth to the tummy. And you can see these little bulges on the sides. Those are called varices, which are just basically really fat veins. You know, like varicose veins in your legs. Just imagine varicose veins in your esophagus. And you get that because when the liver scars down, you know, like we talked about before, like the blood from the abdominal organs go through the liver, right? And it gets filtered through the liver before it winds up to the heart, right? That's what normally happens. But if the liver scars down, it's sort of like the 405 highway on a rush hour, right? Blood begins to pool in the back, and when it pools in the back, because it can't go through this far down liver quite as easily, the veins go into the stomach, the esophagus, and everywhere else, they begin to swell up really, really big, like a traffic jam. So when that happens, it swells up really big, and if it gets too big, they can pop. And when they pop, you can get massive bleeding, and you know, many of the patients who I see at the STAR clinic who have hepatitis C cirrhosis, I see them as new patient visits after they get discharged from LC, USC because of massive gastrointestinal bleeding. Okay, that's how they present. And then those are the varices. And then there's treatment for them where you can sort of make the vein smaller to help reduce the risk of that. Okay. Down below, similarly, when the blood begins to pool, you know, because it's not going through the liver well, the liver not only sees blood that's returning from the organs in the abdominal area, but also blood returning from the extremities as well. So when the liver is not working well because of the traffic jam, the blood, you know, pulls back into the feet, and when there's a high pressure in the veins, that pushes fluid out into the skin, and that's why you get something called edema, which is, you know, a swelling of fluid in the feet. Okay, and also, you know, the liver, like I said before, it makes chemicals to sort of help, you know, proteins to help, you know, prevent this from happening. So when the liver's not working, those little chemicals that help pull in the fluid into the arteries and veins, they're not there anymore. So the fluid, you know, doesn't have anything to hold on to it in the blood vessels. So that's why you get the swelling. And then here, some of that swelling, not only does it go into your feet, but that swelling can also go into your tummy as well. See, so sometimes you can get something like a really big tummy with a lot of fluid inside of it called ascites. Okay? And see, he's balancing a big bottle of vodka. Okay? So basically, there is treatment for hepatitis C. There's a new pill formulation that's been shown to be very effective with less side effects. And it ranges in price from $30,000 to $100,000 for about a 6-month treatment. But it has been shown to cure some types of hepatitis C. There's many different types of hepatitis C virus, but the good thing is that these pills can treat the most common types. Okay, and you know, there's certain indications for, you know, when that treatment is, you know, effective and stuff. So basically, when a patient comes in, I would need to draw blood tests and evaluate the person to see if they're a candidate for this very expensive treatment. You know, one of the things that is contraindicated with this is if someone is an active intravenous drug user, they have to have 6 months of clear urines before you know, they would be eligible for this, because, you know, it's a big societal expense, you know, because, you know, someone's paying for this, you know, the insurance company or the taxpayers are paying for this, so they want to make sure that whoever starts this program, they can finish it, you know, so they don't want to start this really expensive program if somebody, you know, if there's a concern that they may not be able to finish the course, because ultimately that would be a waste of money, so they try to triage that. So that's one of the things that you can do, you know, as non-medical providers is, you know, when you talk to your patients with hepatitis C, having a conversation with them if they're actively using drugs, that, you know, hey, do you want to try to go to the substance use treatment program or something like that, you know, because that can help them eventually, you know, make it possible for them to get this treatment that can be curable. Okay, and then if the pill doesn't work, then some candidates, liver transplant's a possibility as well, but that's even harder to come by, as you sure all know. Okay, so some of the things that can affect progression to cirrhosis, alcohol use. So that's something that, you know, that can be discussed, you know, inside the clinic, but also outside of the clinic as well. That's something that definitely can be in your domain to talk to them and to help them up to, community resources, to help with alcohol use. Co-infection with HIV and other viruses. So when I talk to folks about using, a condom, if they're sexually active and they have hepatitis C, even though it's a theoretical risk that they can transmit hepatitis C, through like vaginal sex without blood, the bigger concern is having them get exposed to HIV or another type of virus to make the hepatitis C worse. So having a conversation with them about, safe sex practices. Diet is important. You want to make sure that they have a healthy diet, and just other comorbidities, like the drinking, the smoking, things like that. Okay, any questions on hepatitis C before we move on? How many of you have seen a patient with hepatitis C or cirrhosis? Okay.
He actually died from it eventually.
Oh, you did?
Because he wouldn't stop drinking. He tried.
Right. No. Drinking is one of the hardest things to quit. Because the thing is that many times there's always a reason why someone drinks, and getting to that root cause, which probably resulted, many people who drink, the problem, started from like a trauma from a long time ago, and being able to deal with that is very hard. Okay, so let's talk about diabetes. But diabetes is too much sugar in the blood. Okay, so we all know that diabetes, insulin, sugar, we all heard of something like that. Okay, but the simplest explanation I can give for diabetes is just basically, if you have like a cup of coffee, and then you put sugar in it, and you stir it around, the sugar dissolves and stays in the coffee, right? But what happens when you put in too much sugar into a cup of coffee and you stir it? It stays to the bottom, right? So diabetes is like that as well. When you have too much sugar in the blood, that sugar goes somewhere, right? So the sugar can go into your eye, it can go to your heart, your nerves, your kidneys, and that's what causes the damage, okay, with too much sugar. Okay, so there's two types of diabetes. There's type 1 and type 2. So basically, this all depends on insulin and how the body responds to it. So in type 1 diabetes, there is no, so basically insulin is a compound that tells your cells to pull in sugar from your blood. So if you eat something, your sugar gets really high in your blood, and the insulin gets made, and it tells the cells in your body to pull out that sugar and store it in your cells for later use. Okay? So basically, in type 1 diabetes, the pancreas is the organ that normally makes insulin. The pancreas does not make insulin. Okay? So without insulin, the cells don't have any signal for it to pull out the sugar. And the glucose, the sugar, are these little green things right here. Okay? So that's type 1 diabetes. And type 1 diabetes, a lot of people get this when they're really young. It's normally caused by some type of damage to your pancreas, whether or not that's from sort of like a autoimmune condition where the body attacks the pancreas by itself, whether or not it's from heavy drinking, and the drinking causes pancreatic damage. But eventually, it's just the pancreas doesn't make enough insulin. So in type 2 diabetes, and we see a lot of this in our patients, the pancreas does make insulin, but the thing is that the cells are not sensitive to the fact that there's insulin in the blood. So there's insulin in the blood, but the cells are looking at the insulin and saying, oh, I'm not going to do anything. Okay? And a lot of this is because for type 2 diabetics, many of the people are overweight, so the cells that would normally take up the glucose when they see insulin, those cells are already full. It's sort of like you think about like an attic. You can only fit in so much junk in an attic before you can't fit any more stuff. Okay, so people who are very, very overweight, their cells that would normally pull in the glucose, if there's too much of it in the blood, they're already at maximum capacity. Okay, so that's why we often say that for people with type 2 diabetes, exercising, losing weight can help by making these cells sort of smaller, so that way when they do have glucose outside, they can pull in that glucose once they see insulin. Okay. Okay. So similar picture to the hepatitis C picture that I showed you before, but basically, again, diabetes, you get these complications when the sugar that's too high in your blood sort of precipitates out and affects different areas of your body. So, like I said before, the sugar can get into your eye, and then you can get something called retinopathy. And actually, diabetes is the leading cause of blindness in working age adults in the United States. Okay, so when a patient comes in and sees us in clinic, we'll always refer them on an annual basis to get pictures of their eyes inside to make sure that that there's no diabetic retinopathy, and if there is, there's certain treatments that we can provide with lasers and things like that with the ophthalmologist that can help prevent this from getting a lot worse. Okay. The diabetes, the sugar can also get into the brain, and it increases the risk of stroke. Okay. The diabetes also can get into the heart and cause heart attacks. It can get into the nerves, cause nerve damage, and it can cause like different types of problems with the feet, such as like pain in the feet called neuropathy. And also, when diabetes gets into the blood vessels and the nerves in the feet, you can get complications like this, which are like the worst case scenarios. So you can get gangrene of the foot, where the diabetes causes the blood vessels to sort of shrivel up, and the toes don't have any blood supply, so they just turn green, mummified, and they fall off. You can get these ulcers, okay, because when you have diabetes, you lack sensation. So if you were to step on a little splinter or something like that, you won't know about it. So you keep on walking on it, and then the wound gets bigger and bigger and bigger. Or when you have, normally you have certain sensation in your feet that help you sort of keep balance to your feet, help you, regulate the positioning of your feet, for comfort, things like that. When you don't have that, you don't have that type of, those reflex movements, on your feet. So you wind up staying in the same position without the nerves to feed back regarding how you're walking. You could be walking funny and putting pressure on different parts of your feet that shouldn't see pressure, and then you can get ulcers like this. Okay? And then this is what happens also with diabetic neuropathy. You can get something called a Charcot foot. And you can see here that when you don't, have the nerves telling your body how to walk right, you begin to walk funny, and then when you walk funny, you can cause inflammation and irritation of the ankle joint, and over many, many years, the ankle joint can begin sort of collapsing on itself because you're not walking right, because you don't know, because your feet aren't giving you that signal back regarding, hey, move left, move right, a little bit more. Okay? And then the sugar gets into your kidneys, you can get kidney disease, and a lot of folks on who are on a dialysis, they're on dialysis because of diabetic kidney disease. Okay. So the treatment for diabetes, there's pills that we start off with first. Well, we always start off with diet and exercise first, okay? If that doesn't control the diabetes, then we move into the pill. And for people with type 1 diabetes, the pill doesn't work. You can exercise your brains out, and it's just because your body isn't making the insulin, you need to give yourself insulin as well, which is up here. Okay? Okay, any questions with diabetes? I'm sure you've all seen people with diabetes, right? And probably pretty bad diabetes. Okay? And the take-home point with this again is, this is just to give you an overview and a familiarity with these conditions, not to make you experts in diabetes, but there's things that, that we can do before the client, comes into the clinic to be seen, whether it's the STAR clinic or somewhere else, okay? So if they have Medi-Cal, for example, if they have Elecare or HealthNet, both of those insurance programs have diabetes teaching, where you can get on the phone, and then you can arrange an appointment for a nurse and the patient to call and talk on the phone about diabetes. If the diabetes is really bad for the client, with a lot of amputations and dialysis and things like that. Actually, I talked to both of those insurance companies, and they can even arrange for like a visiting nurse, or and to get the person into their diabetes case management. So just knowing that those resources are out there, so when you talk to somebody with diabetes, and knowing that of these complications, just know that there are resources out there you can tap into, before the person comes into the clinic. Okay? They can call themselves, or you can assist them in calling. Okay, so this is the heart. Let's talk about heart failure. Okay, so this is a picture of a heart that's part of a heart transplant. So it's cold, and there's like blood pumping through it to keep it alive. Okay, and this is what the heart normally looks like. So when you cut it in half, there's 4 chambers to the heart. There's 2 upper chambers called the atrium, and then 2 lower chambers called the ventricles. Okay, And this is a cartoon of what those 4 chambers look like. So liver's down here. We talked about the liver already. You know, blood from the feet and the abdominal organs go through the liver. Then it goes through this vein called the vena cava. And then it winds up going into the right atrium. Okay? And then from the right atrium, it goes into the right ventricle. And the right ventricle on this side of the heart pumps that blood that's returning from the body through this thing called the pulmonary artery that's blue. Blue means no oxygen. So it pumps the blood returning from the body through the pulmonary arteries into the lungs. And the lungs is where you know, you get oxygen and you get rid of the carbon dioxide. And then once the blood gets oxygenated, it returns through these arteries into the left atrium. The left atrium then pumps the blood into the left ventricle. Oh, this is a typo. Left ventricle. And then the left ventricle then pumps it out to the body. Okay? So that's what a normal blood flow should be like. Okay? So in congestive heart failure, that's when the pumping mechanism isn't working. Okay? So again, this is the normal heart, and there's 2 types of congestive heart failure. There's one where the ventricle, the walls of the ventricle sort of get really, really large. So basically, you know, through evolution and through time, the body has found out that this specific size of muscle tissue is the ideal that you need for your heart to pump at its best. Okay? So if you enlarge this, the heart doesn't pump quite as well. Okay? And you can get this type of congestive heart failure through high blood pressure. Because, you know, like when you're at the gym and you know, you're lifting a lot of weights, your biceps will get bigger and bigger and bigger, and that's good. And your heart, when it's under strain, will get bigger and bigger and bigger as well. But for the heart, that's not good. So an example of this would be high blood pressure. So, you know, when the ventricles have to pump against high blood pressure, they have to work harder to pump that blood out. So when that happens, this gets bigger, and when it gets bigger, the heart doesn't work well, and that's when the blood flow isn't ideal, and the blood starts backing up into the lungs and down into the feet. Okay. Another type of heart failure is what's called dilated heart failure, which is just basically when the wall of the ventricles get very thin and very big. So you can get this, for example, after getting heart attacks, where, you know, after you have a heart attack, the heart heals itself by creating scar tissue. But the scar tissue is very thin and it gets bigger and bigger and bigger, sort of like a water balloon. Okay? So, like I said before, you know, through evolution and stuff, the heart has an ideal width and an ideal size to make it pump the best. So if it gets too thick or if it gets too big, then it doesn't pump well. Okay? And then that's when fatness begins to happen. And we'll talk about that next. Oops. Let me try to find pictures. Oh yeah. This is what happens when you get congestive heart failure, either because the heart you know, gets too big and it balloons out, or it gets too thick. So basically, the blood basically winds up pooling into the lungs and down into the feet. So you get swelling in the ankles and the legs, okay, because the heart isn't able to pump all that blood out to the body, so it's backing up. So it's, you know, getting swelling in the ankles. You get swelling in your abdomen, very similar to cirrhosis. You can get water in the lungs, so oftentimes people with congestive heart failure can get short of breath. Okay, and when the fluid is in the lungs, it can be called either something called edema or pleural effusion. Just know that there's water in the lungs. Okay, and then people can feel fatigue, shortness of breath, and just feel really tired. Okay, and you know, and then the treatment for congestive heart failure include improving the risk factors causing the congestive heart failure, controlling the amount of fluid that the person has, and also medications that can improve heart function as well. So this is where, just like diabetes, it's important, you know, when you talk to a client, you know, to make sure that they know how to fill their medications at the pharmacy. You know, like I have patients that come in, and then, you know, even though I wrote them for a 1-year refill of medications, they come in 2 months later and they're like, hey, I'm out of my medicines. And then I show them the bottle, and I'm like, look, you have 8 refills left here. There's no reason why you should have taken your medicines. You know what I mean? And this is something that I think this type of education for the clients, it can happen in the clinic, it can also happen beforehand as well. I think we all know how to read a prescription bottle, right? Many of our patients don't know how to do that though. So, that can be something useful to talk about, making sure they know how to refill their medicines and making sure that they know that refills exist. So, what's the primary cause of congestive heart failure? Foods that can cause high blood pressure, so a lot of salty food. Smoking, if you get a heart attack, you can get dilated cardiomyopathy that we talked about. So, talking to a client about 1-800-NO-BUTS, which is a free, phone number that anybody can access, to help them learn to quit smoking. And then once they go to 1-800-NO-BUTS, they can get a certificate, and then with that certificate, they can get like nicotine gum and patches. They can do that. Talking to somebody about referring to them to weight loss and dieting. Both of the insurance companies have case management for obesity, counseling, and support. With a health educator, also with a nurse as well, if they're deemed to be especially at high risk. And then I think some of the programs that you guys are a part of, there's like healthy eating, healthy living classes that some of these folks can attend. Regarding how to learn how to cook more healthy and stuff like that. Okay, so that's about it. Did you guys have any questions?
I have a question about obesity, but you basically answered it with the everything she said, that if you reverse like your obesity and start losing weight, your liver will still stay damaged and scarred, or?
Yeah, so for the fatty liver,
Yeah.
it's many, many years for you to get that type of scarring from fatty liver. So fatty liver, if you were to lose that weight and exercise and cut down on on all of that, the fat would go away, and then the liver can definitely heal itself. But scarring is scarring. You can't fix scarring. Once it's there, it's there. So, let me ask you, because we have time, right?
Yeah.
So are there any really any challenging patients you guys want to talk about that you sort of encountered recently where they came into your office and there was a medical issue that came up that you didn't know how to help them?
I have a question.
Okay.
You're referring, say, one of our clients out there at our clinic, and they're being seen, are they going to be screened to get a full physical and all that when they come in, like cancers and all the blood work and everything, physical,
Yep.
health workup? So, because somebody who typically see, not necessarily have been a doctor for a long time,
Yeah.
and things, and might have a lot of things going on that we're aware of. So,
Yeah, so basically how primary care works is, it's a relationship between the patient and the provider, and then for each visit, we try to tackle a few things each time. So if a patient comes once, it's important to make sure that, the conversation would be, when's your next appointment, okay? Because there always will be a next appointment in primary care, okay? Especially for our clients, because basically everybody enrolled in the Housing for Health program, they're enrolled because they have significant medical problems. And they've been, in and out of ERs and hospitals all the time. So those type of problems really need sort of continuity of care and continuous care. So, maybe on the first visit, like a general assessment can be done. A few of the most pressing needs can be met for the first visit, but then normally they would be scheduled for a follow-up where additional problems can be discussed and addressed. Do you guys have? So I know that some of you have patients that go to the STAR. Do you have patients that go to other providers? Okay. So what's your experience like with working, having patients go to those other clinics and other providers? Do you find you're making appointments easy or hard, or getting communication from them, getting forms filled out? I'm sorry?
It's difficult.
It's difficult. What makes it difficult?
I think that they aren't really familiar with the forms, and they don't understand that they are needed, like, right away. Like, they'll get the forms, they'll sit on them. I will try to explain to them what it means to say. They don't want to hear it. They'll complete it wrong. We end up having to go back. It's a bad marriage. But, also, I have another question, Dr. Shaw. When does diabetes become chronic? Because I had an individual who was diabetic. He applied for special needs housing, and the doctor would not say it was a chronic disability. And we didn't understand why. Was it because it was managed? Was it because he didn't have any amputations or any accompanying things that would maybe kill him? Like, we didn't understand what.
Yeah. So there could be different possibilities, you know, and I can't read that doctor's mind, you know, but I think the problem that we face with these forms, and that can be something to think about regarding how we can, you know, rewrite these forms, is the term disability. So disability is not a medical term, it's a contractual term. So for example, there's no one definition for disability. You know, if you go to SSI, GR, private insurance, housing forms, each one has a different idea of what disability means. You know what I mean? So basically for a housing form, disability is if you have diabetes and you feel that the person's health would be severely impacted by being on the street regarding managing your diabetes, right? That's a very low bar regarding what disability means, right? So a lot of, I think, providers have a hard time when they look at the forms saying, is this person disabled? You know, because when we think about disability regarding SSI or other types of disability, disability means having a physical impairment that prevents you from doing certain occupational activities. You know, the housing form, disability does not mean whether or not you can get a job or not. It just means, you know, if you have any problems that are chronic, meaning it lasts for a long time, that would be worse on the streets than versus shelter. You know, so I wonder if we need to talk about, and I don't know who the best person would be, having like a cover page for these housing forms to talk to the provider about this is what disability means for this. Because when you give a provider a form that says, is the person disabled, but not defining what disability is, you know, they may have ideas in their head what disability means. Maybe disability then means the person's in a wheelchair and they can't use one leg or one arm, and then pretty much nobody's going to be disabled, right? But most of our housing clients, you know, would qualify under housing disability. You know, so I think that could be something that we can, you know, think about regarding, you know, as a policy change. Yeah. So, so did that answer your question?
Yeah.
I think that's what happened there with our Section 8. They changed the disability form and the way they wrote